Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Okay. Normal pressure hydrocephalus. Okay, in the normal pressure hydrocephalus, there is a triad is important in normal pressure hydrocephalus, where the patient develops abnormal gait, the patient develops dementia, and urinary incontinence. Abnormal gait, dementia, and urinary incontinence are common in normal pressure hydrocephalus. Then, in normal pressure hydrocephalus etiology, why does this occur? The normal pressure hydrocephalus will mainly occur whenever delayed absorption of the there is delayed absorption of cerebrospinal fluid into the ventricular venous system. Okay, because of that, there can be obstruction to the normal flow of the CNS. Okay, because of the obstruction of normal flow of CSF, this will result in normal pressure hydrocephalus. Here, in normal pressure hydrocephalus, we will have to consider the history we should take the history, and in the history, if the patient has conditions like if the patient has meningitis, or if the patient has history of subarachnoid hemorrhage or history of head trauma, okay, these can result in scarring of basal meninges can occur. Because of the scarring of the basal meninges, this can result in delayed absorption of the venous system, resulting in normal pressure hydrocephalus. Here, if you see the pathology of normal pressure hydrocephalus, you will see that on the gross examination, you will see that there is enlarged lateral ventricles are seen, which are nothing but which will signify that the hydrocephalus which is present here with little or no cortical atrophy. Then this hydrocephalus which is present is actually communicating hydrocephalus may be present in the patient. Then if you see the examine the pressure of the CSF, if you examine the CSF, the pressure of the CSF is in the normal range but on the higher side. It is high normal range, that is it is normal but on the higher side the pressure is present. Then the total leukocyte count, differential leukocyte count, and the proteins in the CSF and sugar in the CSF, all these are normal in the CSF. And how are you going to treat the patient with normal pressure hydrocephalus? In normal pressure hydrocephalus, ventricular peritoneal shunt is put in the patient in a patient with normal pressure hydrocephalus.
thank you and thank you for watching.